Well, staying with this story, we're joined now in studio by Louise Bichet, Middle East Manager at Médecins du Monde, or Doctors of the World. Louise, thank you so much for coming in to us in studio today. Now, your organisation is on the front line in Turkey and Syria. Just tell us from what you know. We saw 2 reports there coming from Syria and Turkey, but what is the latest according to the people that you have working on the ground?
Yeah, as you're saying, we have people here in Turkey and Syria for many years now from Médecins du Monde. So it allows us to have very fresh and recent news about the situation. Of course, places are very much devastated. It's desolation almost everywhere, very hard to reach physically to the places, hard to reach people also on the phone. There are a lot of communication issues and difficulties. So it's quite hard in that sense. It's also very cold. It's a harsh winter this year, so it also complicates a lot relief and international aid in that kind of situation.
And just in terms of the scale of what's happened, the WHO saying that up to 23 million people may have been affected. How do you get help to so many people who are in need?
Well, it's very important. Again, being there for many years, it matters a lot in terms of efficiency and reactivity in this kind of situation. We have private funds thanks to the generosity of the public, of the general public. So it helps us also to be very quick in this kind of situation. We are doing a very rapid assessment of the situation, just to prioritize the first needs for everyone. Of course, there are things that we know already. We know that there will be traumatology, healthcare, who will be, of course, very much needed. Again, people are cold, people are hungry already. We are already 48 hours after the first earthquake, so this is already known, if I can say. Of course, psychological first aid is also crucial in this kind of situation. We also know that women are most at risk in terms of violence in this kind of situation. I mean, sexual violence as well. So it also matters a lot in our initial assessment. We also have to count the health infrastructure that are still standing and the one who are not. We are counting also the medical staff available, able to work or not. That's the kind of things that we are doing right now.
And Louise, as you say, we're 2 days nearly into the search and rescue effort. Is there much hope now at this stage of finding more people alive?
We see some nice story, of course, a few hours, and it can still happen, but most of the time, people who are still stuck on the rubble, it will be less and less survivors. That's most probably.
And we can see, actually, as we're speaking, there's some live pictures coming into us. Just we can see the devastation in Turkey. Just talk to us a little bit about the situation for your employees who are working there. I believe some of them may have been caught up themselves in this tragedy.
Yeah, definitely. Either themselves, it's some members of our team are dead. At least their families have been also either injured or dead. So it's really hard for the team, but they are very much involved and dedicated to the cause and willing to help and to start to answer. So even though they are themselves very much affected by the situation, they are also ready to start helping and to start the work. So it's really something that we are proud of. Yeah.
And in the immediate aftermath of disasters like this, we see obviously a lot of attention on these countries, on the immediate needs of the people who are living in these worst affected regions. But how do you care for people going forward? There's the scale of the devastation. It's so widespread with so many people affected. How do you and other aid organisations support them on a longer term basis?
Well, the first on the first stage, there is a huge issue and concern about coordination of aid. It is something that we really need to follow very closely, and it will be a huge issue again in Turkey and in Syria as well. That's for sure. For the long term, well, Médecins du Monde is working can work in emergency context, but as I said again, we are here in Syria for many years now, working with partners in all different controlled areas. So we are able to work with partners that also work here for many years, such as MIHAD, for example, who is a Syrian organization of medical staff. So able also to help in the long term to support training of medical staff, for example. That's the kind of stuff that we are able to do and will have long-term good impact, positive impact.
And speaking of the situation in Syria particularly, the international community, it's rallied very quickly to send support to Syria and Turkey, but some people are saying that it's not getting there quickly enough. But how much are your staff working on the ground? How much are they hindered by the geopolitical situation in Turkey, just even getting access to those regions?
Yeah, that's for sure. Humanitarian access is a huge concern as well. It was before, but of course now it's very much emphasized by the earthquake. As you know, there is one access point in the north of Syria, in the Turkish and Syria border, in Bab el-Hawa entry point, which is every 6 months renewed by the Security Council at the UN, but it's not sufficient. That's the first point, and there is a need of humanitarian access, much wider humanitarian access, so that we are able to reach every population that are most in need, without any consideration of political agenda or military agenda.
And the Idlib region as well, held up by rebels there also. That's another concern for people living there, but also aid workers.
Yeah, of course. But again, we have teams that who work there for many years and who have been able to negotiate humanitarian access, who are known and able to work in this kind of context. Of course, it's difficult, and again, we are very much appealing for every possible access for staff, for goods, so that we are able to reach every areas.
And after 12 years of civil war in Syria, people there already displaced by the conflict.
Yeah.
They have had barely anything to begin with now. Many of them have nothing. How do you offer help to those people?
Yeah, this is why we are organizing delivering of winter kits, for example. We are supporting partners to distribute food baskets. This type of action is crucial in the coming days. There is also a huge issue about drinkable water, because there is a cholera epidemic still in Syria. So, as you said, 12 years of wars, it means water infrastructures that are already destroyed or damaged. So it's going to be a huge concern in the coming days.
Do you expect that we will see another influx of refugees from these countries into Europe as a result of what we're seeing? We still don't know what the final death toll will be. Clearly tens of thousands of people affected, though.
Well, people are still moving, that's for sure, and taking a lot of risk for migration, as long as borders are closed and people are not able to seek asylum where they need to. Then they will take a lot of risk for their own lives. So that's also a major issue for Médecins du Monde, that's for sure.
Okay, thank you so much for joining us in studio this morning. That is Louise Bichet, Middle East Manager at Médecins du Monde, or Doctors of the World.